I'm Christy South. I'm an OBGYN here with Graves Gilbert Clinic.
My name is Mark Yurchisin. I'm an obstetrician gynecologist and I practice gynecology here at the Graves Gilbert Clinic.
We're very excited to offer the MonaLisa Touch here in this office. MonaLisa Touch was actually a laser system that originated in Europe and has gradually come to the United States. One of the biggest issues that I deal with my ladies, whether they're premenopausal or postmenopausal, is difficulty with vaginal health, meaning dryness, pain with intercourse. And up until now, we've had only limited treatments for that, mainly hormone therapy. The MonaLisa Touch is a laser system that allows us to deliver that energy inside the vagina in a quick, relatively painless process that's about less than 5 minutes. During that time, the tissue itself is stimulated to increase its glycogen stores, elastin, just like we would think of ladies doing lasering to the face to decrease our age there. It increases collagen production, moisture to the vagina, and overall improves the health of the vagina. So we typically offer that to ladies in treatments 6 weeks apart, recommending about 3 treatments for a complete course. After the first treatment, within about 24 to 36 hours, ladies can already see a huge difference.
What this laser actually does is it stimulates neovascularization, or new growth of blood vessels within the vaginal wall. Also, it stimulates collagen and elastin formation, which has become very thin in the postmenopausal state. And that's under the condition of lack of estrogen. And so the laser therapy will actually reverse that process and restore the thickness and the health of the vaginal mucosa. So the beauty of this procedure is that it's in office, and it only takes about 5 minutes per treatment. That's the internal and external treatment both. There's no anesthesia. There's minimal downtime after this procedure. I've had patients tell me that they went home an hour or so, they had like a sunburn effect externally. They had a little bit of burning or discomfort associated with it. The ice pack was enough to suffice. They didn't require any kind of post-operative narcotic therapy or pain medication, and they were back to work the next day.
So patients say that very quickly they're seeing relief. They're seeing moisture return to the vagina, normal lubrication, intercourse is no longer tolerable. It can be enjoyable again, it can be comfortable again. Some conditions of the vulva and the vagina aren't just dryness, they're irritations or inflammations, and we're also treating more medical conditions as well, not just vaginal dryness. So overall, we're seeing ladies very pleased with their therapy.
If a patient sees this and hears this, I think that my message would be, you don't have to suffer silently anymore. You don't have to not tell somebody about this. Tell your physician, call us. We'd be more than happy to help you, because there's no reason for you to just grin and bear it, so to speak, or pretend like it doesn't exist, or find out some kind of a workaround. We can restore your vaginal health and hopefully your sexual health and functioning to a normal level with this treatment.